Hello again, everyone, and welcome to Marquette University Law School, the virtual Lubar Center. I'm Mike Goucher, and this is On the Issues. Today, we're talking with Reggie Moore. He is the director of the Office of Violence Prevention in the City of Milwaukee Health Department. We'll be talking about the surge in violence we saw last year in Milwaukee. It was a surge that many cities all around the country experienced. We'll be talking about some of the reasons, at least some of the thinking behind what's been happening. And then we'll talk about the strategies that are being employed to try and deal with this spike in violence. First of all, begin by saying welcome back to the Lubar Center to Reggie Moore. It's good to have you with us today. Let me
Thank you. Good to be here.
Yeah, let me talk a little bit about the numbers from last year. That's always a good place to begin a discussion. Tell us about the number of homicides we saw, the number of suicides we saw, the number of shootings we saw in the city of Milwaukee in 2020.
Thank you for having me. Yes, last year, 2020, was a tragic year for our city and cities around the country that were impacted heavily by the conditions that were created as a result of the pandemic. And I'll talk about that more throughout the conversation. But understanding when we look at violence as a public health issue, we understand that violence is concentrated often geographically in communities that also have high rates of concentrated poverty and other disparities that we know contribute to enhanced risk for young people, for families, and entire neighborhoods. And I think the pandemic, pretty much expanded that risk in greater areas of our city and impacted families who are already in communities that were already struggling with significant disparities that we know exist in Milwaukee. And in 2000, we had 190 homicides is where we ended the year last year. And these are UCR homicides, Universal Crime Reporting. And those are the numbers that are shared with the FBI by local police departments. They do not include officer-involved shootings or homicides or self-defense. These are strictly things that have been classified as homicides, just to put it in context. And in comparison, in 2019, we ended the year with 97 homicides. And what's important to note is in 2018 and 2019, we basically ended the year with less than 100 homicides in 2 consecutive years, and we hadn't done that since 2014. And so people often don't realize that we actually had a steady 4-year decline in homicides and non-fatal shootings from 2016 through 2019. And again, as we know, 2020 was a tragic year that really set us back. But we're committed to trying to return to the momentum that we started by really, again, elevating violence as a public health issue, calling for more hands on deck in addressing this issue, and again, doing everything possible collectively as a community to address this. The thing that also goes underreported and people don't talk about nearly enough is the level of non-fatal shootings. And these are individuals that have been shot and survived their gunshot wounds. And last year we had 764 non-fatal shootings. And when you think about the trauma and the ripple effect that a shooting has on a family, on a school, on a person's social network, on a neighborhood, or even on an entire city, when you turn on the news at night and you hear that 2 people have been shot or 5 people have been shot, that is a lot of trauma in our community. And you multiply those types of numbers. And we typically see over 300 non-fatal shootings in an average year. And so when you multiply that over a decade or over 2 decades, and then you multiply that by cities around the country, gun violence has always been a public health crisis. Unfortunately, we have been slow politically and also slow, quite frankly, in the public health arena and acknowledging and addressing it as the public health crisis that it is.
So do we see, Director Moore, do we see 2020 in some ways as an aberration, that it is something that is unusual, that it is not the trend that we were seeing in the 4 previous years? Is that the way you see it?
Correct. And that's not just from a place of hope. That's also just in terms of when you look at trends, you tend to look at them on a 3-year average. And so in 2015, we had a 70% increase in homicides in the city after going, I think it was 10 to 15 years with very low rates of homicides. And so that year, After that year is when the city decided to expand the Office of Violence Prevention. I joined in 2016. We engaged the community in developing the Blueprint for Peace, which was launched in 2017. And we've also allocated millions of dollars to invest in public health approaches to violence prevention in the city. And so again, it really is about, how do we create a movement around this issue and not just throw up our hands and believe that violence is inevitable. We know that there will be some violence. I mean, when you look at this country, when you look at the world, violence unfortunately, occurs when people don't have or don't pursue peaceful means to resolve conflict. And so our goal on the primary prevention is how do we invest in approaches, particularly with young people, to instill kind of pro-social behavior and skills like social emotional learning, so that when they do encounter conflict or trauma or stress, they're better able to navigate it. But then also on the intervention side, with efforts like 4-1 for Life, people who have either been shot or been involved in violent behavior, how do we provide intervention and support to them to get back on a better track? And then on the healing side, understanding, again, the ripple effect that violence has in our city. How do we ensure that people have access to mental health services and other supports, so that healing can reduce the likelihood of retaliation and also the likelihood of re-injury?
So the pandemic, in your mind, certainly played a major role in this. And I noticed your word was to describe it as a tragic year, and that is. And I mean, we could almost call it a catastrophic year, because if you think about the number of people who died in homicides, or you think about the emotional distress for people who lost a job, the economic distress that causes, the fact that, we had people who were dying from COVID and the stress that causes on a family, 1,200 deaths in Milwaukee County, I think it was, more than 500 opioid related deaths. So we had all of these things happening simultaneously. Is it really about despair and desperation that fuels the surge in violence?
Absolutely. And we see this on a typical year in communities that, again, have high rates of concentrated poverty and other deprivation. And when we look at the sort of residual effects of the pandemic and the shutdown, the economic insecurity that it caused, the housing insecurity, the food insecurity, when people can't meet their basic needs, oftentimes that, some people may resort to acts of desperation and harming either themselves or others. So when you look at, for example, what we call deaths by despair in terms of the overdoses, as well as the suicide attempts, we actually had to create new working groups looking at suicide attempts off the home bridge, and also understanding, how do we ensure that we're providing as much support and making people aware that there are services and supports before they reach that point. And so, again, we understand that it's the conditions that create the risk. It's not about bad people in bad places, which has been, unfortunately, the historical narrative about violence, but understanding, even in my previous work in public health in places like West Virginia and, poor white mining communities, I could have been having a conversation with their public health officials, the same conversation I would be having on 23rd and Center in the city, in terms of what was happening with young people and teenagers around teen pregnancy, around domestic violence, around, drug and substance abuse. And so, again, we understand that poverty is a significant driver of violence. But also, when you look at domestic violence and all of the other tensions that communities and families experienced in 2020, we know that was a significant contributing factor.
You and I think the last time you were at the law school, we talked a bit about the role of trauma in all of this. And I'm wondering if a city like Milwaukee isn't particularly vulnerable at this moment in time with the pandemic and all that comes with that. And I ask that because you wonder if the city, because it has so many people who have suffered so much trauma in their lives, if that doesn't help play into this rise in violence, that people who have been exposed to violence in the past, that there's a relationship between what we see today and those experiences from some time ago.
Right. And just to also, I think it's always important when I'm having these conversations to put in context that, most of our residents and our neighborhoods and our community and our society are safe. And many people choose, even in situations where there's conflict or high stress, not to harm themselves or other people, right? So just to put it into context, and that there often is, even with our work with Forum for Life, we recognize that there's a very small population of individuals that contribute to a significant amount of gun violence in our community. And police chiefs have said that throughout history as well in this community and around the country. So given that context, what we see, particularly in 2020, is the conditions and the stress and the tension being exacerbated. And so that small number starts to grow, larger and larger. And so what we want to do, again, as we continue to try to denormalize violence, because even when you talk to young people and they no longer duck or in the house when they hear gunshots outside. I live in a neighborhood where, I hear gunshots outside sometimes. And so understanding the psychological impact that has, and it should never become normalized. And so there are places in our community where gun violence has been so prevalent for so long and has gone under addressed that it has created this sort of sense of normalcy, not acceptance, but normalcy that where there's nothing we can do about it. And so, again, I think the blueprint was an opportunity of bringing the community together to not only share best practices from around the country and locally, but most importantly, derive ideas and strategies around what the community wanted to see in terms of what we can do to address this issue.
Talk more about the blueprint and sort of the strategies that are being employed today to deal with this, what we've seen over the last year or so. But I did want to ask you about something else that happened in the last year. We saw the death of George Floyd and other Black men and women in encounters with police. And I'm wondering if this has anything to do with what we're seeing in the sense that citizens don't feel a sense of trust in police officers and may be less willing to perhaps cooperate with police who are investigating violent crimes, or it could be police who, sensing greater tension in the community, pull back a little bit in the performance of their duties. Do you think what we saw in the streets of this country over the last summer have had anything to do with what we're seeing over the course of the year in terms of violent crime?
Well, one of the things I want to stress, particularly in a city like Milwaukee, we've unfortunately had a very long history of what we would classify as systemic violence, which often has manifested in police-involved shootings or homicides. And there's been, years of unrest. Before I started in this role, I marched with Nate Hamilton, Maria Hamilton for over a year, shutting down the streets of downtown Milwaukee, seeking justice in that case. When you look at the Derek Williams case. And so that was in 2014. We saw the spike in homicides in 2015. Here we are again in 2020. And so just understanding that this wasn't new. The protests that we saw, although the scale may have been greater in 2020, this has been a cry in this country for generations that has gone unheard. I think what made 2020 unique is that you had more people who were more concerned and more willing to acknowledge what I think Black and Brown communities have been saying for a very long time, and actually responding to that and being willing to take to the streets and march and walk and stand with communities that have been disproportionately impacted by police-involved shootings. And when we launched the blueprint planning process at the very first meeting, the community was animate about two things. And this goes back to your earlier question about trauma. The first demand was that this blueprint, when we talk about resilience, can't be about making communities comfortable in their pain and in their despair. And so it really has to be about addressing the root cause of that trauma. And we often say there's nothing more violent than policy. And there's been very intentional decisions in this country, in this county, in this state that have contributed to the despair that we see in Milwaukee, that has produced the racial outcomes that we see. The second demand was that this blueprint could not just deal with community violence, it also had to deal with systemic and structural violence that manifests in segregation, that manifested in redlining, that manifests in barriers to employment and to capital for entrepreneurship. And so when you look at, for example, the partnership between the Bucks, the Brewers, the Packers, and Microsoft around their equity league to invest in people of color and businesses in certain communities, all of that was an outgrowth, again, of this cry in 2020. But it was a cry that these tiers are long and the journey to justice has been steep. And so Again, we definitely look at the intersection of community violence and systemic and structural violence. And systemic and structural violence is supported by structural racism, by sexism and patriarchy and other systems of oppression that, again, protect against the manifestation of justice that communities have been demanding, again, for generations.
So let's talk about how we change things. And I'll ask you a very direct question. A lot of people have done rethinking over the course of the pandemic about the way they do business and whether things work or whether they don't work. And I'm wondering, we have the Blueprint for Peace 2018 community effort, and there was success. But do things change now? Do we have to rethink any parts of that, tweak any of it? Or is it still basically, do you feel, the right thing for this community?
Good question. I think the blueprint has continued to be affirmed in a number of ways. I think one of the first sort of grassroots efforts around looking at the city budget, led by the African American Roundtable and Liberate MKE, they actually surveyed, over 1,000 residents around their priorities in the city budget, and public safety came up, and they affirmed that they wanted sort of non-policing investment in violence prevention. And so that was an affirmation of the process that we had already engaged in getting community input around the blueprint. I think it was also has been affirmed in 2020, where we now have cities calling us who are now launching their own processes to develop their violence prevention plans, establishing offices of violence prevention. When I started in 2016 and I looked around the country, there weren't many offices of violence prevention. In Oakland, they've actually hired a chief of violence prevention who is equivalent to their police chief, their health commissioner. It's a cabinet level position and has a line item in the budget. That's how seriously they're taking sort of a comprehensive approach to this issue. And so, again, we definitely look at the blueprint as a living document, but at the same time, I don't think that we've done a good job as a community in terms of ensuring that the strategies that the community has called for have been adequately funded and supported. So before we sort of change and revisit, I think we have to also hold ourselves collectively accountable for actually being responsive to the strategies that were already identified.
So what would you like to see? What are we currently not doing that we should be doing from your perspective?
Right. I think we have an urgent opportunity at the state level to invest in supporting local communities and dealing with the disproportionate level of violence that we saw in 2020. I think the state has been totally absent on violence prevention. I think the governor has an opportunity to establish a statewide task force on gun violence that has been called for by groups like WAVE, the Wisconsin Anti-Violence Effort, that is supported by the Office of Violence Prevention, and also establish a statewide violence prevention fund that can invest in public health approaches to addressing gun violence, to addressing suicide, and again, the other contributors in domestic violence as well. So at a state level, that's an urgent request and thing that I think that we should expect greater leadership on, both from the state legislature as well as from the governor's office. On a federal level, I would definitely like to see the Biden administration really follow through on their commitment of creating a $900 million investment fund for violence prevention nationwide. And I think, unfortunately, with the historic levels of violence that Milwaukee experienced, should be a priority city for that investment. You may recall some of the controversy over the recent COPS grant. I don't think there would have been controversy over funding for violence prevention. And so, again, I think when the only resources that are being allocated to cities are disproportionately focused on criminal justice solutions, but are not available for nonprofit or community-driven solutions, as Patrick Sharkey mentioned in one of your earlier panels last year, these are the types of investments that we need both at the federal, state, and local level to really make the things like the blueprint real.
How confident are you that some of those things that you just discussed will come to fruition, that people will take steps that would accomplish some of the goals you just laid out?
I don't think that will happen without a level of pressure that's needed. Power concedes nothing without a demand. And I think that the community has to hold elected officials accountable and expect that public safety, and particularly violence prevention, is a priority. And so the more that I think communities take on that charge and make that a priority issue as it relates to policy and leadership, that's the only way that I see that change happening.
I'm wondering if Some of the programs that the Blueprint for Peace has instituted, I think about the violence interrupters who try to stop violence before something happens, and then they step in and they try and stop violence from happening again in our community. Were they affected by the pandemic? I mean, we're all talking about social distancing, don't let strangers in your homes, and yet they need to communicate with people. Was that hindered in any way during the pandemic, their efforts?
It was definitely early on. I would say during the spring, where the shutdown was instituted, they definitely had to scale back. And we also worked with our partners at Frederick Hospital and the Medical College of Wisconsin as a level 1 trauma center. Most of the gunshot victims in our community are treated there. And so we worked with them to really recalibrate how we can support families and gunshot survivors. So we ended up going virtual in terms of their initial contact with survivors at the hospital was made via FaceTime, and they were able to, again, provide support to the family. And then slowly through the summer, they returned to in-person engagement, particularly in the community. As I shared with you offline, before we started, we unfortunately, gun violence was not slowed by the pandemic, and clearly it was exacerbated, but we had no idea how historic the levels of violence would be in March, April, May of 2020. And so, we had several mass shootings, the last one at Mayfair Mall, but then the first one after the Molson Coors shooting was on 12th and Locust. And our team was on the ground passing out masks and PPE and trying to provide support to that entire community. And so, in terms of our outreach, it really did not slow down. And then after that, we had the protest movement, which we were also out trying to provide, support and safety to the community as they engaged in exercising their First Amendment rights. And so, as far as violence prevention, we never really got a day off, or it never really slowed down for us. And the work of the violence interruption team, both in interrupting retaliatory violence, but also equally important, actually mediating conflicts before they actually escalated to violence, I think is a story that also goes undertold. And so the life-saving work of that very small but mighty team is profound. And that's the investments from the state and the federal government could really support the significant investment that the city has made in launching 411 for Life. But clearly, given the level of violence that we saw in 2020, there's an opportunity and a need to expand that. And we can't do that without resources, especially given the fiscal crisis that the city is facing.
I want to ask you a question about what you've described to me in this interview and how Milwaukee police view this. Do you feel that the police, the leadership of police, is on the same page with what you're talking about, or do they still feel that they need more resources, that they need more funding? Are you on the same page in terms of your discussions?
I'm happy to say this publicly, and I think it needs to be said. The current administration in the Milwaukee Police Department is actually the best administration that we've had since I've started in 2016 in this work. Unfortunately, and you see this around the country when I talk to my counterparts, where oftentimes there's this push-pull or even conflicting relationship because policing has had a monopoly on public safety since the founding of this country. And understanding when you have other people in the community calling for a broader approach to public safety, redefining and reimagining what public safety means, some people are threatened by that. But the current leadership of the police department under Chief Norman, as well as the head of homicide and sensitive crimes and violent crimes, understand that they can't do this alone, and that they obviously are responding after a harm has happened. And so I think all of us, if we truly care about the safety and well-being of this community, want to see the harm actually reduced. We want to see the trauma actually reduced, not necessarily having to respond to an increase in the harm and the trauma. And so understanding that the criminal justice system can't do that alone, because somebody has been harmed and somebody has caused harm by the time that system gets activated. And so if we can invest in things that we know work on the front end that reduce the likelihood of harm happening, I think everyone across the criminal justice system, in the community, elected officials, all agree those are things that we should also be equitably investing in. And so our focus has really been on If we have a $300 million budget for policing in our city, and again, I don't think Milwaukee is unique in the size of its police budget, we have to have an equitable investment in public health approaches to this issue as well, if we truly want to make Milwaukee and cities like it around the country safer. And again, we're hearing and seeing police chiefs, not only in Milwaukee, but around the country, who are embracing that, not only that conversation, but also standing with us and calling for those investments.
You know, it was interesting. We talked to Patrick Sharkey, who you mentioned earlier, Princeton University professor, sociologist, who's written a lot about crime trends in this country. And he had written a piece in the Washington Post, and the piece essentially acknowledges something that I think, could be the basis for common ground. I'd love to get your feeling about this. And that was that if you talk to police officers or police chiefs, and I have over the years, and I remember former Chief Flynn saying, look, people expect us to be social workers. They expect us to be mental health experts. They expect us to do all kinds of things, and frankly, that's not what cops should be doing or are even trained in some cases to do. That there is the possibility of acknowledging that there are some things that might be done better by someone else and allow police to focus on their core responsibilities. Do you see that as an area of possible common ground?
Absolutely. Absolutely. And I think smart police chiefs around the country acknowledge that. I think, obviously, Chief Norman, even when we did our press conference early in this year, talking about the violence in 2020, but also our renewed commitment as a city in addressing this issue in 2021. We stand united in terms of understanding that this has to be an all hands on deck effort. We talk about this a lot when it comes to domestic violence. Perpetrators should be able to get help before harm occurs. But unfortunately, we often wait for harm occurs and then use the jail as a way of dealing with that in terms of extraction of an individual, when oftentimes what we hear from even abusers is that they grew up in homes where abuse was common, where they were abused. And so again, to your earlier point about trauma, if we don't heal and address that cycle of trauma, it often gets repeated and it gets transferred. And the same thing is true for understanding that violence is a manifestation of unmet human need. And so understanding that we can't cop and cage our way out of this pain. We also have to invest in stopping the pain and breaking the cycle of pain that has transcended generations in our country and in our society.
So let's look ahead and look at 2021. And so, I looked at the homicide numbers. They're very similar so far to last year, at least at this point in time. Is the pandemic going to have to end before we begin to revert to a more normal pattern here in Milwaukee? Or is there a lot that we could still do that would begin to mitigate some of these numbers that we've seen?
There's definitely a lot that we can do. Like many people, I was hoping that 2021 would be a light switch, and January 1st, all would be well in the world. But I've likened it more to a season change, and seasons don't change on a dime. And so as we continue again to recover from the at least height of the pandemic, it's going to take some time. But I'm optimistic, but it's not going to change or get better by itself. And I think, as the Office of Violence Prevention, working with our community partners, we definitely are committed to amping up our efforts. And we have done that as well as we move into the summer, and having a lot of conversations, looking at the data, looking at where incidents are happening, strategizing around increasing outreach, response, and support to families. Those are all things that we're looking at, as well as a population that I think also is being overlooked, except when it comes to the conversation about virtual learning, is really the recovery of our young people, and understanding how much they've suffered under this pandemic. And as we move into the summer months and into the next school year, working with many of our youth serving agencies in Milwaukee around the supports that they need, to, again, as we move to more in-person programming and services, ensuring that young people and families in our city have access to all of the supports that they need. But again, we can't become lax and expect things to change by themselves. We all have to roll up our sleeves, demand the resources that are necessary, and put in the work on a daily basis to make our communities better with our community.
I want to go back, and maybe this is a good way to end our conversation, but I want to go back to something you said earlier, and that the concern is that we grow numb to this in our community, that we just have a certain expectation. No, there will be this level of violence, and it's just the way it is. We can't change it. I heard you address that earlier, but I want to return to that. That has to That has to be a great concern to you, that we begin to just say, well, there's not much we can do.
And, they're sort of overt, right? Attacks on a community, but I feel like inaction and complacency is just as violent. And you're absolutely right. That is not something that we can, allow or even tolerate. That we need to expect of our leaders and each other that we're doing everything possible to prioritize the preservation of life in our city. And again, not waiting for harm to happen, but also investing and supporting strategies and solutions on the front end to ensure that young people and families in our community have an opportunity to thrive and to want for all families in our community the same thing that we want for our own. And unfortunately, when we don't see the humanity in each other, when we don't see the humanity in certain neighborhoods and zip codes in this city, our inaction, our deprivation, and the way that we look at and treat certain communities reflects that. So again, I think it's a collective accountability to ensure that these types of conversations continue and are elevated, but then that we also at the voting box and every day in this community are ensuring that peace is prioritized as a policy issue in our city and across this state.
Reggie Moore is the director of the Office of Violence Prevention in the City of Milwaukee Health Department. Always enjoy our conversations. Thanks so much for being with us today for this this virtual version of On the Issues. And we'll also say thanks to everybody who's watching. We're always glad to have you along for the ride. So we'll see you next time on the Issues. Thanks again.
Thank you.